we begin, we wanted to share some exciting news. Monarch Medical Technologies, the maker of EndoTool, is now part of Gluco. Together, we're bridging the gap between inpatient and outpatient diabetes management. By combining EndoTool's proven inpatient insulin dosing capabilities with Gluco's leading outpatient digital health platform, we're creating a true continuum of care that supports clinicians and patients alike, ensuring safer transitions and better outcomes across every setting. You will not notice any change in the EndoTool application. By way of introduction, I'm Dr. Paul Chidester, formerly the Chief Medical Officer at Monarch Medical Technologies and currently the Medical Director at Gluco, and I'll be moderating today's panel. My background is as a clinician, I've worked as a nephrologist, and I've been a Chief Medical Officer with Centera Healthcare, where I've implemented similar glycemic management systems in the past. With that, I'd like to introduce our panel. First of all, we have Dr. Scott Ashowski, who is the Chief Medical Information Officer at Beacon Health in Michigan and Indiana. Rana Schechter, who is the System Line Director for Diabetes at Sharp Health. Melissa Chenard, the Medical Director for Medication Safety at VCU Health. Allison Barnum, who's a Critical Care Clinical Pharmacy Specialist at Trinity Health. And Deborah Murphy, a Senior IT Analyst with UNC Health. As many of you know, implementing patient-specific insulin dosing isn't just a clinical decision, it touches every part of the hospital. Nurses may worry about the learning curve, pharmacy has to ensure medication safety and utilization, IT needs to align workflows and EMR integration, executives need a clear case for an ROI and operational value. Each of these perspectives matters in making a decision to implement an insulin dosing system, and the success depends on bringing them all together. So that's what we'll be exploring today. You'll be hearing from leaders across nursing, pharmacy, IT, medication safety, and executive leadership about how they navigated resistance, built confidence, and drove adoption. Each panelist brings a different lens from frontline impact to enterprise-wide strategy, and together they'll share lessons you can apply whether you're making a case for change or sustaining momentum after go live. Our goal is to give you practical tips you can take back to your own hospital, strategies to secure buy-in, anticipate objections, and frame the value of patient-specific dosing in ways that resonate with each stakeholder group. Before we dive in, we want to go over some housekeeping items. All of your microphones are muted during the presentation to minimize background noise. We encourage you to use the chat function for any questions or comments, and we'll address those in the Q&A session at the end of the webinar. This webinar is being recorded, and all those who registered will receive a recording in the email when it is ready. With that, let's dive in and hear from our panelists.